Hello students, welcome to All About Nursing channel. So today's video is going to about the conduction system. Basically we are going to talk about in this video the different arrhythmia. When we see different arrhythmia like in case of heart block, in case of atrial flutter or ventricular tachycardia, what happens in the heart contraction or in the conduction system. So we are going to see that in that video. Okay, so this is the normal conduction system, normal beating heart. You can see there is rhythm is regular, the normal there is systole and diastole is 1:1, you can see. So here you can see this is the electrokinetography report of a patient who have complete heart block. You can see the ventricles and the atria is contracting in different way. So atria is contracting in its way and the ventricle is contracting like it's by its. So the student, you can see that it is a arrhythmia, that is complete heart block, where we can see by the EKG report, electrokinetography report, where we can see that in complete heart block the ventricles is contracting and the atria is contracting, both are contracting report, where you can see the ventricles and the atria both are contracting, but the ventricle and the atria is contracting in, there is no coordination between the atria and the ventricles, they are contracting there separately. Okay, there is no coordination. Okay, next students, you can see this is the atrial fibrillation on EKG. You can see the atria is fibrillating, there is a fibrillating there is a continuous fibrillation in the atria, you can see, and this is a continuous fibrillation in the atria. Okay, and the ventricle is, the rhythm of ventricle is regular, but the rhythm of the atria is, there is increase in the rate. The rate of the ventricle is same as normal heart, but the atrial rate is increased. And you can see in the ECG there is P wave, there is no defined P wave, there is fibrillatory P wave. The QRS complex is the normal, there is normal QRS complex, but the fibrillatory P wave you can see in the ECG. Okay. Next, you can see it is called sinus bradycardia in EKG. You can see the rate is decreased less than 60. You can see the heart and both the rhythm is regular. The atrial and ventricular coordination is same. The rhythm is regular, but you can see the rate is decreased. So you can see in the ECG that is there is prolonged distance in the P complex. Okay, you can see there is a wide gap. Okay, that is called sinus bradycardia.